Pregnancy is a time of hope. A heartbeat you haven't heard yet, but already love with your whole being. But sometimes, that hope is suddenly, painfully interrupted. A miscarriage is a word loaded with sadness, questions, and silent grief. If you've experienced one, or fear you might, you are not alone. You are not broken. And this is not your fault. In this video, we'll explore the causes of miscarriage in a compassionate and honest way, so that you can begin to understand what might have happened and find the peace you truly deserve. A miscarriage is the loss of a pregnancy before 20 weeks. It happens in about 10 to 20% of known pregnancies, but experts believe the real number may be even higher because many occur before a woman knows she's pregnant. There are different types of miscarriage: chemical pregnancies, missed miscarriages, incomplete and threatened. But the most common happen in the first trimester. The emotional toll? Unmeasurable. But understanding the why can be the first step to healing. The most common causes of miscarriage: 1. Chromosomal abnormalities, the number one cause. By far is the most frequent cause of early miscarriage. When sperm and egg meet, the embryo should receive 46 chromosomes. But sometimes there's an extra, a missing, or broken chromosome. These genetic errors happen by chance and can prevent the embryo from developing normally. Most of the time, it's nature's way of protecting the body from continuing a pregnancy that couldn't thrive. Chromosomal abnormalities cause about 50 to 70% of first trimester miscarriages. 2. Hormonal imbalances. Hormones play a delicate role in preparing and sustaining pregnancy. If levels of progesterone, the pregnancy hormone, are too low, the uterine lining might not support the baby's implantation and growth. Conditions like PCOS, polycystic ovary syndrome, and thyroid disorders can interfere with hormonal balance and increase the risk. 3. Uterine and cervical issues. Sometimes the shape or health of the uterus can make pregnancy difficult. Uterine septum or fibroids can block space for growth. Cervical insufficiency, where the cervix opens too early, may lead to a miscarriage later in the first or second trimester. Past surgeries or infections may also leave scar tissue. 4. Infections. Some infections, especially those that go unnoticed, can harm a developing baby. These include rubella, German measles, toxoplasmosis, listeria, from undercooked meat or unpasteurized cheese, STIs like chlamydia, syphilis, or herpes. Even untreated urinary tract infections, UTIs, if they spread, can raise the risk. 5. Chronic medical conditions. Pregnancy is harder on the body than many realize. If you're living with conditions like uncontrolled diabetes, high blood pressure, lupus or autoimmune disorders, kidney or heart disease, the risk of miscarriage may rise, especially if the condition isn't managed carefully before and during pregnancy. 6. Immune or blood clotting disorders. In rare cases, the body may see the embryo as a threat. Conditions like antiphospholipid syndrome, APS, or lupus anticoagulant syndrome can trigger clots in the placenta, cutting off the baby's oxygen supply. 7. Advanced maternal age. As eggs age, the risk of chromosomal abnormalities increases. A woman in her early 30s has about a 15% chance of miscarriage. By 40, it's closer to 40 to 50%. At 45, it could be up to 80%. This isn't to scare, but to inform, because age is a factor, not a failure. 8. Lifestyle and environmental factors. Exposure to certain toxins, radiation, or harmful chemicals, especially in industrial jobs, can affect pregnancy. Heavy smoking, drug use, and excessive alcohol are also strongly linked to pregnancy loss. 9. Trauma or physical injury. Despite myths, normal activities like walking, sex, or lifting moderate weight don't cause miscarriage. But major physical trauma, such as car accidents or severe falls, can result in loss, though this is rare. You didn't cause this. You couldn't have prevented it. And your body is not broken. A miscarriage is not just the loss of a pregnancy. It's the loss of a dream, of a future you already began imagining. And it's okay to grieve that, even if it was early. Even if others don't understand. Healing starts when we replace silence with support. When we allow space for sorrow. And when we remind ourselves, you are still a mother. Your love was real, and you did not fail. Miscarriage is deeply personal, and no two journeys are the same. But from the ashes of grief, many women rise, stronger, more connected, more compassionate. If this video brought you comfort, understanding, or simply reminded you that you're not alone, please like, share, or leave a comment. Your voice may be the one that helps someone else heal. You are loved, you are enough, and there is still hope.